All right, let's dive into this fascinating case. On ultrasound of the breasts, the first thing I notice is that this patient has bilateral breast implants. So far, so good. But here's where it gets interesting. The right implant has an irregular outline, and there's an irregular hypoechoic area in the upper outer quadrant. It's not looking quite as it should. Then, in the right axilla, we see these hyperechoic foci with what's often described as a snowstorm appearance. It's as if the lymph nodes are throwing a winter party, but that's definitely not what we want to see. The left implant is behaving much better. It shows these two clean hyperechoic linear lines anteriorly and posteriorly with some internal reverberation artifact. That's all normal for an intact implant. Now let's move to the MRI. In the right breast prosthesis, we can see multiple low-signal wavy lines, which are a textbook sign of implant rupture. In the right axilla, those well-defined foci have signal characteristics consistent with silicone. And we even see further high-signal foci in the right infra and supraclavicular regions. The left implant, on the other hand, is completely intact, and importantly, there's no breast mass on either side. Putting this all together, the findings are consistent with a rupture of the right breast implant, and given the silicone infiltration into the draining lymph nodes, we're dealing with an extracapsular rupture. The snowstorm appearance in the lymph nodes is a classic sign of silicone infiltration. The left prosthesis is normal, and there are no additional abnormalities. So what's next? This patient needs to be reviewed by a breast surgeon. Implant removal will likely be required, and further discussions about implant replacement or alternatives can follow depending on the patient's preferences and clinical situation. To sum it all up, we've got a case of a right extracapsular breast implant rupture with silicone infiltration of the draining lymph nodes. And that snowstorm we see on the ultrasound isn't a scene from a holiday movie. It's a clear radiological clue that makes this diagnosis unmistakable. If you're enjoying these case discussions and want to see more unique imaging scenarios, make sure to subscribe to Radiology Made Easy. Turn on notifications so you're always in the loop. Fast hurry, and good luck with your studies and exams.